Before we get started, we'll wait a couple more minutes to let everyone join. My name is Sarah, and I will be hosting today and interviewing Cathy and Kassie. While you wait, we do have a little box right below our faces asking what topics you would like to see in the future for our webinars. So if you have any suggestions or things that you would like us to plan for in the future, please feel free to type in your answers there. And if you can't think of anything now, but think of something later, that box will remain there for the remainder of the webinar. Oh, we got one suggestion in post-operative care in the hospital. Thank you for that, whoever submitted that. It is anonymous, so you don't have to tell us who you are. All right, so it's 12:15, so we'll get started. Thanks again for joining today. I work in TMLT's marketing department. My name is Sarah Bergmanson. I'm the digital and social media specialist. And I'm talking here today because this webinar is all about getting to know our webinar hosts, Cathy and Kassie. They have a ton of knowledge when it comes to the practice issues that physicians face. So in addition to learning about them, you'll also hear about their top recommendations for physicians to mitigate risk. And we do hope that the audience will participate and submit some questions. So there is a Q&A pod in the lower right hand or lower left hand corner of the screen. So if you have any questions about what we're talking about today or anything else, please feel free to type in your questions. I'll be monitoring them. So if I don't see it right away, don't worry, we'll be sure to get to them all. And if we don't see it, we'll get to it at the end, but we'll try to incorporate your questions as our conversation unfolds. So I'll go in, give a little bit of background in case you don't already know. Cathy is the manager of the Product Development and Consulting Services Department here at TMLT, and she has more than 30 years of experience in the healthcare industry. She was formerly a nurse, hospital administrator, and compliance officer, and she spearheaded the development of our cyber risk management services, and before that worked as a risk management representative. Kassie is a risk management representative in the risk management department and also has a very diverse background working in healthcare. Before joining TMLT, she was a marketing operations and physician recruitment specialist. And in that role, her duties included practice development and managing a medical service referral program for an 11-county region. And both Kassie and Cathy are certified in healthcare privacy compliance. I won't share too much because I'd like to give them a chance to talk more about their backgrounds themselves and go into a little bit more detail. So whoever wants to go first, Cathy or Kassie, please go ahead and tell us a bit more about yourself and how you began a career in risk management.
Well, I'm Cathy Bryant. Thank you for that nice introduction, Sarah. I started in risk management on the hospital side many years ago in a small facility where we wore multiple hats. I did a little bit of administration. I did a little bit of risk management, quality improvement. Back in the day, that's what it was called. But, it really seemed to make sense that if we could avoid having problems arise by managing risks up front, that it would be better off for whatever organization in the long run. And that really piqued my interest in sort of the proactive side of being prepared to and hopefully avoid certain risks.
So I'm Kassie Toerner. Thank you, Sarah, for
Cathy, would you like to?
Yeah. Sorry, Sarah. Thank you for hosting us today. And I'm Cassie Toerner, as I mentioned. And as you mentioned, Sarah, I've had a rather diverse career in healthcare. Most of my roles have been around supporting physicians and practice management and a variety of other things so that they can focus on patient care, their goal. I've been in this current role with risk management, compliance, HIPAA, and cyber for almost 9 years now.
Cassie,
Surprisingly, it's gone by so quickly. But again, as Kathy mentioned, I like the preventative approach and trying to help, get things before they become more of a problem.
Thank you. I think there is a little bit of a hiccup in the connection on your end, Cassie, just FYI.
you might you might try turning off your
Okay.
camera and turning it back on, Cassie, and see if that helps.
Thanks. Sorry about that, folks. Okay, well, Kathy, please share a little bit about what you do at TMLT.
I'm sorry, Sarah, you broke up on that one.
Okay, sorry. I was asking if you could share about what you do at TMLT, your previous roles, and maybe what you do now.
Sure. So, uh, previously I was in the risk management department. The risk management department does the practice reviews that practices can request, and Cassie will probably talk a little bit more about that. But additionally, currently I work in product development and consulting services. We largely focus on helping physicians and their practices with all things HIPAA and cyber risk management on a daily basis, everything from telephone consultations to actually doing risk assessments and helping them develop plans to improve their compliance.
Thank you. We have Cassie back. Cassie, we were going into what it is that you do at TMLT, and Kathy just shared. So if you'd like to talk about what your current role is in the risk management department.
Sure. So I am a risk management representative in our risk management department, and we conduct practice reviews for our policyholders. The goal of the practice review is really just to be another set of eyes and offer meaningful feedback and recommendations. It's not punitive in any way. We're really just trying to be a resource. The core of it is based on the Texas Medical Board rules of documentation. Again, it's something that we hope and feel is a good resource to our policyholders, and so I work with our risk management team doing those, and also developing resources that we find are meaningful to the physicians or hot topics or trends that we see in the risk management department. And I also work with Kathy to provide HIPAA risk assessments,
Thank you.
basic
Yes,
compliance, and
and
cyber
just to
guidance.
quickly plug in, if you don't already know, that you can reach out to the risk management team and Kathy. Works more closely with the cyber risk management side, and Cassie doing the practice reviews. But they are available Monday through Friday, 8 a.m. to 5 p.m. So if you never have a risk management question, definitely feel free to use us as a resource. That's partially why we're here today, to tell you about all the fabulous things they do. So Kathy, as you said, you often help physicians with HIPAA training. What knowledge gaps do you find most often when it comes to training physicians and their staff about HIPAA?
Well, sometimes we find practices that are just starting out that want to get started on a real firm footing with HIPAA, and they want to know how to build their HIPAA compliance program from the ground up. Sometimes we talk with practices that have been in the business for a while, and they either hear about something new, or they're struggling with a certain part of compliance, and they reach out to us. We really look at HIPAA compliance as having four major components. The first one is that you have to do a risk assessment under the security rule to make sure that you are meeting the HIPAA security rules. You have to have a risk management plan to mitigate the things that you find in your risk assessment. You have to do ongoing training for your workforce, and you have to have written policies and procedures.
And because we're talking about HIPAA, let's go into a quick little poll to test our audience's knowledge. So I'm going to drag this over. Hopefully everyone can see it. Okay, so just for a fun little pop quiz, tell us if you know what the acronym HIPAA stands for. I know in the past, everyone used to misspell HIPAA, and then we throw it around all the time. But there might sometimes is confusion about what it actually stands for. I'll wait. I'll give it a little bit more time. See if we have any. So it looks like a lot of people are choosing option B, Health Information Portability and Accountability Act. And it actually, the correct answer is, drum roll, I see like the bars toggling. All right, so it actually stands for Health Insurance Portability and Accountability Act. So I know I was surprised when I saw the word insurance in there, because I definitely thought privacy or information would make more sense. So it looks like a majority of people didn't actually know that. So kudos to the 3 people that did. All right, let me hide this.
You know, HIPAA is often misunderstood, and if anyone wants a history on all things HIPAA, we'll be happy to provide that offline.
Yes, I think Cathy knows how to make HIPAA fun, if anyone thought that those 2 words could be used in the same sentence. It looks like we did get a question. Is there a required or recommended frequency for risk assessments?
So the requirement is that you have to do one when you start using electronic protected health information. And for many practices, that was a number of years ago. The requirement also is that you should do one whenever you make a major change to your network or to your system. So if you change EHR vendors, for instance, if you go from a server-based to a cloud-based, you should be doing another risk assessment, because the whole concept is, are you mitigating risks with your change, or are you adding risk? The cyber insurance, the cyber attorneys that we work with really recommend that you look at doing one every 1 to 2 years, just on a proactive basis. And if you're ever investigated by the Office for Civil Rights, or the HIPAA police, as we jokingly call them, then they actually would be able, or they can ask for not only your current risk assessment, but anyone for the last 6 years.
Well, that was a really good question, Lou. Thank you for submitting that. I think that's something that y'all get asked quite often. So, all right, Kassie. So within the practice reviews for policyholders that you do often, what recommendations do you find yourself giving the most to physician practices?
Sure. So like I mentioned earlier, our practice review is based primarily on Chapter 165 of the Texas Medical Board rules. And we actually have a great team who tracks this data for us, so we kind of know where the majority of our recommendations are. It helps us to stay current and relevant to provide the feedback. The most common recommendations that we've been giving based on 2020 are around the use of EHRs, which is probably no surprise to anyone. We know that there's a lot of check boxes and click fatigue. We all feel it even more so now, living in the world of pandemic and these virtual platforms. But sometimes we see where information is contradictory within the EMR system, because let's say, for example, the HPI says nausea or vomiting, but the review of systems wasn't checked off and it just defaults to negative. And so sometimes we see that, and that's a very common recommendation. Also, pre-formatted templates not being updated to reflect the current date of service or the care provided for that particular day. Consent sometimes is that we see pretty frequently where informed consent is not documented, or even a verbal consent for an office procedure not being documented into the chart. And those are the primary top ones that we see in our risk management department. And with that, if you're ever interested, I know those of you who are on here today may have participated in a practice review before or not, but we do have a link on the side there in that web links. If you would like to request a practice review, then you can just
Also,
click on
I'll
that link and
add
get a little
that
bit
a
more
practice
information.
review, completing a practice review and correct me if I'm wrong, meeting the requirements does help you earn a discount on your policy as well. And I believe that's a 4% discount. Is that correct? Oh, even better. Okay, you know better than I
5%
do.
unless something has changed that
Actually,
I'm
I
not
should know.
aware
I'm
of.
in
Yeah,
marketing.
yeah.
All right. Yeah, so there's some web links on the left-hand side, and we'll talk a little bit more about what's there as we continue the conversation. So going back to HIPAA, recently MD Anderson won an appeal against the OCR for a fine of $4.3 million in HIPAA penalties. So Cathy, can you talk about the significance of this case and its possible effects on OCR investigations going forward?
Well, without getting too technical, because the court opinion is very technical, uh, what MD Anderson's win actually is significant for is it's the first time that any covered entity that had been fined by the OCR challenged the OCR's findings and penalties in court. The court upheld or did not uphold several of the things that the OCR had stated that MD Anderson had done wrong, and it significantly will change some of the definitions or the interpretation of the meaning of some of the HIPAA rules going forward if if they're if the OCR does not win on appeal, which we're thinking that they probably will appeal, but that has not been decided at this point. So there could still be more changes to come. But things like the definition of how to protect in electronic protected health information was significantly changed with this court opinion. The court also found that the OCR had really overfined, if you would, MD Anderson, and so they would be reducing the amount of the fines significantly. Um, the good news is that it's out there, and there is potentially some positive interpretation changes coming for policyholder, or not just for policyholders, but for all covered entities. But it's only been a couple of months, and so it's a little too soon to change our practices based on it.
Right. Still very interesting nonetheless. Cassie, would you like to add anything to that?
No, I think just echoing what Cathy said, it's interesting. It is very technical, and it will be interesting to see how it, continues to play out
Exactly.
over the course
So
of the next
Cassie,
months
can you
or
talk
years.
about some of the changes you saw in 2020 due to COVID-19?
Everything. No, I think from a risk management perspective and the types of changes that we've seen as, everybody moving to remote work environments, and then telemedicine just being expanded significantly for our policyholders and providers just across the U.S. in general. Here in Texas, we, seeing relaxed rules and guidelines being expanded for the use of telemedicine. We think that that's going to remain in place based on what we see. I know Cathy and I have attended a couple of national conferences the past couple of weeks, and there was a tremendous focus on telemedicine, just ensuring IT security, ensuring secure platforms, ensuring consent, and being mindful of cyber threats and that landscape that's out there around telemedicine now. We also saw the prescribing rules related to opioids be expanded and relaxed, and new classifications of pain added to the TMB rules. So those are new rules that are out there during COVID. And again, just more of a focus on cyber, ransomware, bot attacks, and those types of things have really
And speaking
kind of
of
escalated during
telemedicine,
2020.
have there been any big like telemedicine risk management concerns outside of cybersecurity, or have we seen maybe an uptick in claims as a result of telemedicine or COVID-19?
I haven't seen any yet. Again, I think the big focus is, like you mentioned, primarily on the security piece, also on consent. And honestly, most providers that we've seen, they've done a really good job of documenting in their note when it is a telemedicine visit, if there are limitations to the visit because it is a telemedicine visit. So those things I think we are seeing, and quite frankly, a lot of people shifted very quickly and very efficiently into telemedicine. But I haven't seen any particular claims as of yet, or major things come out of that. Kathy, you may have seen some that I'm not
I think
aware
the
of.
the bigger risk to physicians maybe that we may see early on will be Texas Medical Board complaints, because the Texas Medical Board is relatively prescriptive in some of their rules. And if you haven't had an exposure to all of those rules, I'll give a little shameless plug to our spring seminar. The last one, which is tomorrow night, uh, is all on telemedicine, current and what we expect to see in the future. Dan Ballard, one of TMLT's frequent speakers, does a great job with introducing all things telemedicine. So if you haven't seen that or thought about joining that, that would be a good place to start.
Yes, definitely. Thank you for sharing that reminder, Kathy. If you haven't gotten an email, or check your email, we definitely have sent some emails to get people registered for that CME seminar, and that is tomorrow. And just a little bit more information in case you're wondering, it's a 2 hour long CME, and it can be used also for our risk management discount. And then we also have previously recorded webinars about telemedicine, and we have a whole page on our resource hub dedicated to telemedicine. So if you look at those web links in the left-hand side, you can get to our previous webinars from there. And you can also navigate to the telemedicine page once you're in our resource hub from that link. But if you have trouble finding it, let us know. So still kind of in line with the pandemic, we'll stay on that topic for one more question or a second. So I know the risk management team, y'all have received a lot of calls lately from physicians who are unsure about how to handle patients that don't want to wear masks when coming in for their appointments, or some of their patients maybe are just confused about whether or not they need to wear masks when attending their appointments. So Kassie, do you want to comment on that and share any of the advice that you've been giving?
Sure. I think I'll also give another plug for the hub, because there is a nice article on our hub about masks and the mandate. I think if the physicians have that they want to have that as a policy for the patient to wear a mask, then that's certainly within their ability to do that. We've seen a lot of physicians provide masks if they're able to patients when they come into their offices. But we have gotten that question quite a bit, particularly when some of the mask mandates were lifted around the state and around different cities. But again, I think that it's very reasonable for physicians
And
to
we
maintain a
also
policy to
have
have masks
developed
in their
some
office.
resources about how you can best communicate that to your patients. So there was a question that came in about this. This is being recorded, and the answer is yes. And I also saw a question about, I'm guessing it's in reference to the CME seminars tomorrow, and if it's free. And it is not free, because it is a 2 hour long CME, and we have a guest speaker. So I believe the cost is $100, if I'm not mistaken.
For
So
policyholders.
yes, for policyholders, it's slightly higher if you are not a policyholder. So Before we get to the next question, we'll take a second to do another poll because the next question is related to the poll. So there's a new law that went into effect on April 5th, known as information blocking. And we recently released a webinar about it, but for those who may not have seen it yet, or if you, as a simple test for those maybe did see it, let us know by selecting one of these choices, how well do you understand the new 21st Century Cures Act rule about information blocking? We're getting a little bit of everything, mostly never heard of it, and mostly somewhat understand, and then a few who've never heard of it. Very interesting. Yeah, this is just for because we're curious, trying to take a pulse, not going to penalize you for not knowing. So wow. All right. So Cathy, would you like to talk a little bit more about what this is and what it means for the healthcare world?
Sure. First of all, whoever strongly understands it, I want you to email me because I want to be in touch because this is an evolving level of understanding. Even though Kassie and I have attended many webinars and different kinds of presentations, done a lot of reading on it, there are some questions that we just still don't have clear answers to. But I think if you take a step back and you think about what was the purpose of HIPAA when HIPAA came into being? Well, actually, the law was passed in 1999 and went into effect in 2003. It was designed for covered entities and their business associates to protect patients' information. What the government saw was that healthcare was moving to electronic means, and they wanted to make sure that as data became more available, that it was protected. So if you kind of think about HIPAA as being the protective and ensuring the protections of patient data, while still allowing access, especially to patients. Patients have always had the right to access their information. If you fast forward to the 21st Century Cures Act, the whole focus was shifting to try to make interoperability more important, if you would, and make software play well together. It also was an effort to place an increased emphasis on making it easy for the patient to be able to access their own information in a way that was not going to be cumbersome. It was going to be free, a free way to get their own information. And it basically was still to allow the practices to make some decision about how they were going to share that, what tools they were going to use. But it's more about ease of access rather than protection of the information. Now, that said, I'm not saying you can just throw away all your security and all your cybersecurity. No, you still have to protect information under the information blocking rule, but you have to make it easier for the patients, in particular, to get the information.
Thank you. Kassie, is there anything that you want to add about the information blocking rule?
Cathy is far more eloquent in sharing the nitty-gritty of that. I think the global takeaway for me is that, as she mentioned, just not creating a burden to access and not creating extra cost for the patient to access their electronic health information, the new term that they're using, EHI. So very high level. Cathy is, again,
Thanks,
far
Cathy.
more in tune with that than I am.
If you have questions about information blocking or want to learn more, our last webinar, or maybe a couple webinars ago, we recently put together a webinar on the information blocking rule because it is very new. So we did want to highlight it today. It went into effect April 5th, so it's still very fresh. So the link, by the way, is on the web links pod to the left, on the left-hand side of the screen. So be sure to check that out. Oh, and I just got a message. The webinar for tomorrow is, the CME webinar for tomorrow is $50 for policyholders and $100 for non-policyholders. So I'm sorry I misspoke about that. Thank you, Tanya, for sending that over. All right, so if anyone has any questions, feel free to pop those into the Q&A pod. We're kind of getting towards the end of our discussion. I still have a few more questions, but definitely send us yours. So what is your most memorable practice review or policyholder call, or any memories, that good or bad, that you feel like are worth sharing today? Whoever wants to take the question first, go ahead.
Well, I would say that every interaction with policyholders is memorable because everyone is slightly different. And really, one of the most exciting parts of my work every day is when I get to interact with policyholders and help them with whatever their individual question is. Of course, there have been very many memorable both practice reviews and risk assessments, but it's I would say the most memorable part is sort of watching someone go from maybe not fully understanding something till that light bulb moment when all of a sudden it clicks and they get it and they're ready to move on to the next step. And to me, that's one of the most important or most memorable times.
Yes, sharing the joy. Sorry, Cassie.
Yeah, I think yeah, as Kathy mentioned, no, you're fine. We get a variety of calls in our risk management department, and they can be anything from just trying to find a resource to an emergent type situation. And I know our team is always feels very rewarded whenever we're able to help navigate through a situation that was maybe stressful, particularly with the current environment with the pandemic and whatnot. So that's always very rewarding and very meaningful and memorable when we can do that. I think for me, I had one time a administrator call me after our practice review, and it had been several years, and she just said, "I just want to thank you for the feedback because it did help us during a claim situation, and had we not been doing some of the recommendations that were made, then we probably would have not fared so well." So I thought that was very thoughtful of her to take the time to call and provide that feedback and just let us know, you know. But again, we get a lot of different varieties that are
Thanks for
all
sharing
unique,
that. I
as
know,
Kathy
like,
mentioned.
hearing when policyholders are compliant with the risk management recommendations you give, it's like music to your ears, I'm sure. And somebody did type in that they wanted the link to the webinar or the CME seminar tomorrow, and it looks like someone shared that. You can also go to tmlt.org/seminars, and that will also take you to a registration page. So, Kathy, can you describe a most memorable case in terms of like a cyber hack, data breach, or HIPAA, what's the word, HIPAA fines, anything like that that has stood out to you that people can learn from today?
Well, luckily, none of TMLT policyholders, to my knowledge, have ever had a HIPAA fine after they've been the subject of a breach investigation or a complaint investigation. So we want to keep it that way if at all possible. I think one of the most memorable uh, situations was a while back, but um, it was a very small practice that still had paper records, but they used electronic billing. And uh, ultimately, they were hacked and their data was exposed to the hacker. And it's very difficult uh, for a very small practice that has very few human resources to really face all the things that have to be done very quickly to not only minimize the risk of another event, but just lots and lots of extra work from a staff perspective. They were without access to their scheduling system for a period of time. So you have to get very creative in that they're never sure who the next patient walking in the door is. And that really, by working very closely with them from the time their incident occurred, it really made it very easy to get very empathetic and understand how difficult this is, not only on a day-to-day basis, but just also the mental toll that it takes on the staff who are trying to cope with the aftermath of a breach.
Yes, thanks for sharing that. And I know that's been TMLT's standpoint for a long time, is to really be there for physicians and who are operating a practice all on their own, not part of a large group. And that obviously how things were for a very long time. And so I know that we've always taken a sympathetic approach, and that's why we have such a strong risk management department and develop resources continuously to help provide aid in those situations. We do have a few questions coming in. So let me take a moment to read this, and then I'll ask if someone's asking about the information blocking. Is it true one must have patient portal access to EMR effective April 5th? If so, what are exceptions for hardships and et cetera?
As far as I understand, at this point, there is no requirement that you have to have a patient portal. A patient portal is certainly one of the ways that you can share information relatively easily out of your EMR or EHR, but that is not the only method that can be shared. If you go to healthit.gov, that is the Office of National Coordinator's website, and they have really good frequently asked questions on their information blocking, or it may be the 21st Century Cures Act, I believe is the title of their landing page. But they have, I believe they have some examples in those FAQs of how you can share that information. And again, it's only electronically stored health information. So if you had paper charts, information blocking isn't requiring that you convert those to an electronic media to be able to share them. Now, that may be different under HIPAA and state law, but depending on where you're located. But for information blocking, I would say the answer is no, and there are other opportunities to look at sharing that information.
Good question. Thank you for answering that, Kathy. Kassie, I don't know if you feel like compelled to add to that. I think Kathy answered it well. And so someone is also asking, are information blocking claims covered under current TMLT policy, or is a separate policy needed? And they also added great information. Much appreciated. Thank you. So thank you for your compliments. Let's see. Do y'all know the answer to that one? I know it's kind of complicated now. It's going into a claims or underwriting question.
Right. It's going to depend, I think, on what the allegation of the claim is, whether it would meet the definition of a covered situation. And I know that's not a very clear answer, but it depends is usually the fallback, unfortunately, because so many things, especially with cyber, are somewhat situational. But that is one of the things that that's a great question, and maybe we'll do a little more digging on that and get back with with you or get back on a future webinar with some additional information about that.
Yes, thank you, Kathy. Insurance is complicated. All right, so if there's any other topics that we didn't talk about today, Kathy and Kassie, that you get questions about, feel free. Let's kind of chat more loosely about some other frequently asked questions and what resources you recommend most often to our policyholders that call in.
One other thought that I had with the last question, at this time, there are no penalties for individual physicians or covered entities under the information blocking rule. There may be at some point in the future. There are some penalties for app developers, the EHRs, that kind of thing. So whether or not there's something that would be covered under TMLT's existing policy may be kind of a moot point at this point because we shouldn't be seeing those kinds of allegations yet.
Well, that's good to know. Thanks for adding that in.
And as far as frequently asked or frequent different kinds of resources, we've tried to list those under the web links page or on the left-hand side as far as both internal resources and then the HIPAA FAQs. I certainly go to that website a lot. So to try to help people have a better understanding of all things related to HIPAA.
Thanks, Kathy. What about you, Kassie? What do you most often recommend resource-wise, or what frequently asked questions do you end up answering the most?
Yeah, sure. This year, 2020, obviously the majority of our questions were related to COVID and the pandemic, things that you've already mentioned about wearing masks, protocols for returning to the office, those types of things. We also get a fair amount of calls on patient termination, regulatory updates, changes, TMB changes that are occurring. And as Kathy and I have mentioned, more than you probably want to hear about our HIPAA questions, release of medical records is a hot topic. I will say that Sarah, you and your team have done a fantastic job developing content on our TMLT hub, and all of the things that we've talked about today, I pretty much guarantee there's a resource on our TMLT hub webinar or a reporter article or something. And you guys also do a really great job of getting things out very timely. Something can come out day of, and you guys are getting it out there so that the policyholders have current information. So for me, that's a really great resource to direct our policyholders to get
yes,
good information.
We devote a lot of time to making that resource hub the best it can be and as useful as it can be. So I'll open it up one last time if anyone has any last minute questions. We're wrapping up my portion of the interview, and I hope that you got some valuable insights out of it. And like we've been saying throughout the webinar, please check out these web links if you are looking for more resources on any of the things that we've been talking about. Let's see, I think one more question popped in. Sounds like there's been some technical difficulties with the sound for a couple people, so I apologize about that. Let's see. Sometimes it's
the webinar is being recorded.
Yes.
And if anyone who registered will get a link to the recording, unless the webinar or the recording has technical issues as well. We'll let you know one way or another, but I do think that usually the recording comes out pretty well, even if there are difficulties in live transmission.
Yes. It sometimes depends on the user's internet bandwidth, not always on the presenter side, but sometimes it is. I haven't had too much interruptions on my end, but I'm hoping that it hasn't been. I'm hoping that's been most of everyone's experience, and I apologize for whoever is having the sound technical sound issues. So we did get another question or another person that's asking if you can elaborate on the information blocking. They said, I have an EMR/EHR based on an in-office server, but without outside access other than remote for providers and without patient portal. We do normally give patients CDs or paper for requested information, and we advise that they have their own portal access to laboratory done at a lab. Any comments? This is kind of a technical question. Any comments from you two?
Yes, and fortunately, we do have the person who's asking the question's email address, and so perhaps it would be best if we reach out to them individually because it is pretty specific. But there are some options that are available that would meet the information blocking rule that would not require you to have a portal. So we'll reach out with some resources after this webinar, and if you have other questions, then you can email us back directly.
Great. Thanks, Kathy. Well, thank you to everyone who submitted questions. Don't forget to submit some topics that you would like to see us present about in the future. We want to make sure we're sharing the information you need. So please drop us any suggestions you may have. I think this wraps everything up. Thank you so much, Cathy and Kassie, for being the guests of honor today and allowing me to interview you. I really enjoyed the opportunity to get to chat with you and speak with our audience, the policyholders or not policyholders. But thank you everyone for joining. We'll send you a recording once it's available. Please definitely email us if you have any questions. Check out our CME seminar tomorrow. And yeah, let us know if there's anything else that you'd like us to do future webinars on. Cathy, Kassie, anything else you'd like to say before we wrap it up?
Thanks, Sarah, for your time and for being our host today.
Yes, it was my pleasure. Very fun. All right.
Thank you, Sarah, and thank you for participants for joining us today and taking time out of your day.
Yes, thank you everyone for joining. Have a good rest of your Tuesday afternoon, and we will let you know about the next webinar. It's always the fourth Tuesday of every month, so be on the lookout for our actually, we do have registration available for the May webinar. That will be about our cyber insurance. Is that correct, Cathy? Any plug you want to do there before we sign off?
It is an update on our cyber insurance, and I would encourage all our policyholders to try to either join for the live webinar or certainly register so you get the link to the recorded webinar.
Yes. All right. So we'll be sending you links to register for that soon. I know we did send out one in our events email that went out a few weeks ago, but we'll definitely send more emails about that. So thanks again for tuning in, and thanks again, Cathy and Kassie. Thanks for being such great resources at TMLT and just overall great people. Your expertise is so valued, and yeah, I'm so glad I got to interview you today.